Hey, welcome to my podcast today. Today we're going to have an Autism Live update. So 3 days ago, RFK Jr., our Secretary of Human Health and Services, made an announcement about trying to find the etiologies and causes of autism and trying to mitigate the rapid, what he said, epidemic, describing it as a disease, and also saying that there must be some environmental factors that are affecting kids in a way that is severe and affecting their lifestyle. So I'm going to dive into what the CDC rates are, talk about how RFK Jr., what he got right, what possibly he got wrong, and how can we reconcile what he said with the truth, and look at the research and look at the science and look at what the actual clinical indications of what is autism and what can we do to help our children. So he says that autism is a preventable disease, and he launches an environmental study. So is this true? And it actually caused a lot of lashback, and people were pissed off. And what are the statistics? The statistic says that now in autism is 1 in 31 children. And in California, it is actually 1 in 12.5 children, which is absurd. It's crazy, but these are the numbers. And so why is this a problem? So autism back in 1970 was 1 in 10,000 children. And as you can see, it's been growing at almost an exponential rate. Now, keep in mind that I was in a documentary called Sextortion. You can watch that on Amazon Prime. And I made the comment about how the rates of autism are rising precipitously or dramatically. And at that time, it was in 2020, and the race was 1 in 54. A major news outlet went after me. They got a reporter. They wanted me to basically get interviewed. I didn't want to interview, didn't want to argue online, didn't want to argue, publicly, because I knew the numbers. And so what I said there was citing another research paper that said, if we don't change the course of what we're doing with autism, now this is more than just recognition. This is more than just recognizing the disease and better recognition, because as clinicians, if we are recognizing the disease better, we should be actually helping to reduce the incidence and the prevalence of autism, but we're not. So for example, if I can recognize that sunscreen helps you with your basal cell carcinoma and your squamous cell carcinomas and your melanomas, and we apply more sunscreen because we recognize that these are skin cancers that happen when we're out in the sun, we should see a drop or leveling off of that cancer. But I'm not saying that autism is cancer, so don't get all upset. I know this is a very heated topic. A lot of you probably have autistic children or autistic adults in your household, or you're autistic yourself, or you know somebody with autism. What I'm discussing here is very, very difficult. As a clinician, I understand this, because when patients come in and I tell them something that could have helped them, but it's too late because they already developed a disorder or disease, there's a lot of shame, anger, frustration. And I'm letting you know, it is hard. Autism is tough, and it's a spectrum of manifestations. There are some people that are high functioning. There are others that are low functioning. And the low functioning ones cause an incredible stress on the family. But there should be no shame because you didn't know the data. We don't have doctors who are sharing openly, like what I'm going to share with you today. I would say less than 1 in 100,000 doctors, maybe 100, maybe 1 million, will actually know all the research and all the data, because most of them are in their specialties and they are too busy to look outside their scope of practice. So they are busy grinding through clinic, grinding through seeing patients, a busy 40, 60, 80-day patient load. They're done after 12 to 14 hours a day. They barely have time for their families. If that's the case, do they have time to look into the research? Do they have time to actually think outside the box? And that's what I'm hoping that my channel and this podcast will help you do, is to help you think outside the box. So please, there's no shame. If you have an autistic individual or child, there's no shame. You did not know this data, but you can take action. And if you have a younger child, you can actually take action and make a huge difference. So why is this? Okay, so let's look at the rates. So back in 2020, the rate was 1 in 54. Research was showing that at that rate, the rates were going to double about every 5 years. And at that rate, it'll be 1 in like 10 in basically 10 to 20 years. And that's what I stated in the documentary. And the news just went after me like, you're a quack. You don't know what you're talking about. Where's your data? Where's your proof? Well, guess what? 5 years later, it doubled. It is now 1 in 31. It went from 1 in 54 to 1 in 31, almost doubled. And in California, it actually reached the rate of 1 in 12 and a half. So what are we doing wrong? So we're going to talk about that. So why did, RFK Jr. say that it's environmental? So he called this a epidemic, which is not entirely correct, because epidemics deal with diseases like bacteria and viruses and infections like COVID-19. But this looks like an epidemic because of its exponential rise. What this is a strikingly very dangerous path that we are going into as a society. We will have severely autistic people, and it's going to be permanent brain damage. So it's not an epidemic, but it is a significant problem. So let's don't poo-poo the epidemic terminology, because that's what people are doing on social media. So if you go to social media here, so a lot of people are going online. And what's interesting about this is you got to be careful of confirmation bias. And this is very, very, very dangerous with social media, because confirmation bias means that, for example, in autism, you have like a spectrum. You have high functioning, you have low functioning, and you have individuals between those two extremes. The low functioning are not going to be posting on social media, sharing their pains and their struggles with autistic symptoms. The high functioning individuals who come here on social media and actually claim that it's not true. Claims adults don't have autism. How is the man in charge of health policy again? His statement completely ignores decades of neurological research confirming autism as a lifelong neurodevelopmental condition. Brain imaging, genetic studies, and diagnostic criteria are all clearly recognizing autism in adults. We're going to get to this. There are autistic adults, obviously, but it doesn't rule out the fact that this is a major medical problem. So here's another one. It says basically, official to support autism research, you are clearly mistaken. There is such backlash on this. People will just go on and say, hey, look at my example, because I'm successfully managing my autism, therefore, he must be wrong. Secretary Kennedy must be off base. This is confirmation bias, okay? I see that in a patient population too. They come to my clinic, they did something, and it helped them. And the human body is very complex, and we're going to talk about multifactorial causes of human diseases, and specifically autism. But when you have a multifactorial condition or multifactorial causes in a condition, one thing that may help one individual may not help the other 100. So you can't just claim that just because a person who is high functioning autistic is actually functional in society, that's the case for all people with autism, because I know plenty of autistic people who struggle, and they're claiming that genetics. And so the genetics is a way out. And I understand, and this is going to be very hard to listen, because if there is environmental, if there is toxins, if there is screen time that can contribute and make the autistic symptoms worse, there is incredible guilt. I've had close friends with autistic children who basically lashed out at me, who don't want to hear the research. But what I'm going to share with you today is actually based on a collective research with many people, not just myself. It's other doctors, other researchers in the field, other experts around the world. And so let's really look at what RFK said. So people are criticizing him for saying that autistic people are not going to have functional lives. So let's look exactly what he says about this. So I pulled up the actual interview, and this is the full interview here on Fox News. It's also on PBS and other sites like NPR. So I pulled up the transcript. He says, these are children who should not be suffering like this. These are kids who many, the key word is many, not all, many of them were fully functional and regressed because of some environmental exposure into autism when they're 2 years old. And these are kids who will never pay taxes, never hold a job. And this is where social media blew up because they're like, well, I'm autistic, I have a job. My kid is autistic, they have a job. Okay, that's great. You have a high functioning individual. However, there are severely autistic kids who don't have jobs. I just look around how many autistic adults are at baseball games and sporting events and school events, and they're literally having like headphones on and they're playing video games or looking at their phone the entire time, and they're not functional. I have patients with 2 adult children who are autistic, and they're older men, and all they do is play digital media and watch digital media and games all day long. And those are not functional individuals. And those are what RFK said. So what is the definition of many? Okay, so a couple is 2. Okay, a few is 3. Many is more than 3. So we don't know. So usually we need to dive into this and look at it in research term and define what is many. Is many 10%, 15%, 40%, 50%, 70%? Even if it's 70%, you have 30% individuals who are high functioning, and they're going to be posting on social media how basically wrong this is. So I'm just saying, you got to think outside the box because these are our kids. Your kids are at stake here. So let's dive into what are the factors? So I, as a researcher and a clinician, look at things collectively as a whole. I look at all the research. I don't just look at 1 or 2, and then I combine my clinical experience with the clinical experience of others. Like we have Kevin Roberts online, and basically we have other experts here joining us, like Lori Fromm and also Karen Heffler, MD. And so what I'm going to share with you is a collective whole of what I understand the research to be. So let's look at this. So you can actually create or look at the factors in 2 major categories. There's biological and molecular factors, which is basically genetics, okay? And then there's also environmental, but they're not exclusive of each other. They're actually interacting together. So I'm going to actually talk about that because there's something about epigenetics, and we're going to dive into that a little bit more. So if you look at genetic factors, which affect your biological and molecular mechanisms, there are, for example, genetic mutations that cause single gene disorders. And you see that in like Fragile X syndrome, Rett syndrome, tuberous sclerosis, and also if you have chromosomal abnormalities like Down syndrome, okay? You can also have copy number variants like deletions and duplications that can cause severe problems. You also have de novo mutations. So let's say the environment induces toxins into the DNA, and basically, or the toxins causes DNA mutations. You can actually have mutations that then increase the risk for neurological disorders. The problem is there's been hundreds of genes looked at, and it's been linked to ASD in one form or another. So we think at this point that autism is a polygenetic risk of genetic factors. And so let's look at one paper here. So this paper was published in JAMA, and it's really a good paper. It actually had a population-based cohort of over 2 million born in Sweden between 1982 and 2006. It included twins. So there were 37,570 twin pairs and 2,642 full siblings with ASD and hundreds of thousands of half siblings and cousins. What they showed was that the estimated heritability of ASD is about 50 to 95%. There is a genetic factor to ASD. And these genetic factors make the child at higher risk for autism. However, just because you have higher risk doesn't mean the disease have to manifest. So I'll give you an example. There are diseases that causes certain cancers. Let's look at, let's say skin cancer. There are diseases that would manifest if you go out to the UV light, you get more skin cancers. So just because you have the genetic factor for that disease doesn't mean you can't change your environment to reduce your risk and never manifest that disease. We see that in cardiovascular disease. We see that in liver disease. We see that in nearly almost every single disease out there. Now, there are diseases like, genetic diseases that causes severe neurological impairment in children. Those will manifest, but depending on the environment, the severity or the trajectory will be different. Meaning that if they have the right environment, they are basically in a nurturing environment, low toxins, reduce inflammation in the body as much as possible, their outcomes would be different than if they were placed in a highly toxic, highly stressful upbringing. So that leads us to epigenetic dysregulation. So epigenetics deals with the DNA methylation abnormality. So basically DNA can be methylated. There's like methylation molecules that can be actually attached to DNA. And that basically modifies like histones and how your RNA, which is the messenger RNA that will produce proteins in your cells. So your environment can actually change what is being expressed. Another example is that when you're stressed, you're in a fight or flight environment, you have what we call an HPA axis activation, hypothalamus pituitary adrenal axis activation. HPA activation leads to adrenal secretion of endorphins and cortisol. Most doctors, most scientists stop at about saying cortisol is a stress hormone. But I spent probably 4 or 5 years studying the HPA axis in a research lab. So I understand this pathway extremely well. Cortisol is actually a steroid-based hormone that can bind within a cell nucleus via the steroid binding element. The steroid binding element will actually, together as a complex, modulate gene transcription. So in a fight or flight response, in a stress response, in a condition where your HPA axis is completely always elevated, cortisol is stimulating hundreds, if not thousands, of different types of gene expression in the body. So let's take that example and say, let's say the mother was exposed to a toxin, or a child was exposed to a toxin early on, or even a baby in the womb being exposed to an environment that's stressful because the mom's stressed. The HPA axis is completely elevated. Cortisol is being expressed and changing gene transcription that we have no idea about. Scientists don't know what these things do because there's just literally hundreds and hundreds and hundreds of these proteins that are being expressed, and we don't know how they exactly interact. But it will change the genetic makeup in the brain, the body, your bones, and it will change the way that person or child develops. So let's keep that in mind as we consider environmental factors. So now we have environmental factors, which are what? Like prenatal exposures, maternal infections. So like rubella and influenza infections. There's papers to show that certain infections can actually lead to bad brain development in the baby. There's also maternal immune activation. What does that mean? Probably from vaccinations and other environmental toxins that interact with the mother, which causes an immune response The immune system is inflammatory. The purpose of the immune response is actually to activate a attack on antigens and bad guys, such as bacteria and viruses. However, there's something called antigen mimicry. So during the immune response, if the epitope or the protein that the immune system is developing antibodies against looks like a protein that's expressed in the baby or expressed in the mother, antigen mimicry is the basis, one of the bases for what we know as autoimmune disease. So you can actually get an autoimmune disease. You can actually get your immune system to attack yourself if you get the wrong immune activation. There's also exposure to toxins like medications, valproic acid, pesticides, air pollution. There's also advanced parental age. So the older the mother is, there's a higher risk for autism. And then there's also research to show that maternal stress or mother stress or metabolic disorders like diabetes and obesity can actually lead to higher risk of autism in their babies. Okay, so let's talk about the big elephant in the room, vaccines. Vaccines are completely controversial because the research is not clear. But I'm going to show you a research study here that you have to kind of think. So most of the research studies and most organizations are saying, well, vaccines aren't involved. Don't worry about the vaccines. You know, the studies show that vaccines are not directly causing autism. So when you find papers like these ones, even though this is like, there's a lot of criticism on this paper, it's a smaller paper, smaller cohort, and it's published in an obscure journal. But I'm a researcher, so I know that sometimes, you know, the peer-reviewed process is not perfect. For example, I could have a groundbreaking study. However, if I publish this, my peer review individuals, meaning that my peer-reviewed scientists and research experts don't agree with my theories, they can actually reject my paper. And it just takes like one person out of a panel of 3 to reject a paper. And sometimes these research, you know, review process, there will be some bullies on there. And I've been through that process, so I understand this. So even though it's a good study, they get stuck publishing in a really obscure, no-name journal. So I'm just saying, just because it's a bad, you know, journal or a less read journal doesn't mean it's a bad research study. You have to actually read the study. So what this study showed here, and it's titled "The Pilot Comparative Study of the Health of Vaccinated and Unvaccinated 6 to 12-year-olds in the U.S." So what it showed, and it's a smaller, you know, number here, it's like 600 and something patients. And what they showed here was very interesting. So odds-risk ratios. Odds-risk ratio, if you have an odds-risk ratio of 1, it means there's no risk. If you have an odd-risk ratio of less than 1, then that means it's protective. If you have an odds ratio of greater than 1, that is actually significantly, you know, possibly associated with. So they're looking at, like, for example, chicken pox had a odds ratio of 0.26. So that's protective. Pertussis, odds ratio of 0.3, protective. However, these children who basically got vaccinations, otitis media or ear infections, had an odds ratio of 3.8. They had higher rates of pneumonia at an odds ratio of 5.9. That's pretty high. That's 5.9 times higher than the control group. Allergies with an odd ratios of 30.1. Eczema, odds ratio of 2.9. And then neurodevelopmental disorders like autism and ADHD and learning disabilities, odds ratio of 3.7. So why do vaccines, how can they be implicated in this process? So most of the studies, you have to understand that there's something called an IRB, Institutional Review Board. So they get the experts together, pediatricians and scientists in an institution. let's say they're studying at some medical school or hospital, and they look at what is reasonable without doing harm to the study group. And children are a protected study group, meaning that you would never take all the vaccines that they're now required to take and put them all together in 1 week and see what happens. You never do that. So usually these studies that you're looking at are looking at ones and twosies or threesies, okay? Where they're looking at maybe 1 vaccine, 2 vaccine, 3 vaccines given and seeing there's bad outcomes. But then if you're not giving all the recommended shots of 54 shots, which consists of 70 antigens and 16 diseases all at once, and really studying what that does to a child, you can't say that vaccines are absolutely not involved. If you look at it in 1986, the vaccine schedule recommended by the CDC was only 12 shots. In 2019, is now at 54 shots. And you remember when I talked about the antigen mimicry. The antigen mimicry is when you cause inflammation in the body, and the vaccine can actually activate antibodies against cellular structures that can cause an autoimmune or a autoinflammatory disorder. And that is what I believe that people are saying about the vaccines, is that we have to consider that, because that's not normal. So, but can this explain the dramatic rise of autism alone? Because really vaccine schedules haven't, it changed significantly, but it's not, because there's certain populations that don't get vaccines and still have a rise in autism, and it's terrible. So right now it's like 1 in 31 kids. And in California, it's 1 in 12.5. So what is it about California? Is it it's definitely not like a bunch of inbreeding, or there's something genetically wrong with Californians. I mean, what are they doing in California is different than everyone else. So that is why you have to think about environmental, and all these other things that I've talked about hasn't really changed that much. Genes and genetics have not changed that much. Therefore, you can't claim that this is all genetic, because in the span of 50 years, we went from an autistic rate of 1 in 10,000 to now in 1 in 31 and 1 in 12.5 in California. So genes don't change that much in humans. It just doesn't. So there has to be an environmental. So vaccines could be a possibility. Remember, this is multifactorial. This disease has many, many factors, but the biggest factor that no one talks about is screen time. What I mean is that if you walk around a baseball game or a high school event or out to dinner or at the grocery stores, the screens have become a babysitter because it's conveniently keeping the baby quiet. But we have to ask, what is that doing to the brain? And there are 3 ladies I want to give kudos to who basically got me to do this YouTube live. And they are Dr. Karen Heffler, MD, Lori Fromm, who's an early interventionist in autistic children, and also Jennifer Joy Madden, who's a media expert. And they came up with this idea of babygains.org to raise the awareness of what virtual autism is. And I know that some of you have actually looked at the term virtual autism and got really upset. It's coined by a psychologist named Marius Samphir, who saw a dramatic rise in ASD diagnoses that can actually be reversed by digital detox. What I mean by reverse, and I've seen this by myself too. I've seen kids who were severely autistic, nonverbal, diagnosed with autism at 2, just like what RFK Jr. Or Secretary Kennedy was saying. But at 2, because I recognized it, I, as a physician, took a complete medical history and say, okay, how much screen time are you giving your baby? And they'll admit, okay, it's 10, 12 hours a day. We take away the 10 to 12 hours a day of screen time, that 2-year-old who was autistic, severely autistic, becomes literally normal and drops the diagnosis in 6 months. I've seen also autistic young boys at 8 who would scream and yell when their dads take the iPads away for an hour, and they would have to hold down the child to become nearly normal, high-functioning autistic by the time they're 18. But you have to remember something about this whole virtual autism. If you don't remove the environmental toxin early enough, the brain damage will be permanent. And it's probably, I think, around the age of 18, when it's 7 years before the brain completely matures and gets solidified by age 25. You have to act early. So let's talk about a little bit of brain development. So at ages 0 to 3, it's a critical for mirror neuron development, meaning that there was a monkey experiment where, for example, a monkey was watching a researcher unpeel a banana and was able to eat the banana or something like that in the lab. And because of the mirror neurons, the monkey was able to see that and imitate that. So these are critical ages at 0 to 3 for mirror neuron development, where you want your baby to emulate you. You want your baby to emulate people. You don't want your baby to emulate what's on the screen. Because when they emulate you, they have better language development and they have better social emotional circuitry development. And those are the critical years. If they don't get it between 0 and 3, it becomes very difficult for them to have those functionalities and higher executive functions as they get older. The screens absolutely do not provide an interactive stimuli needed for neural pruning and connection. And these are all well referenced. Dr. Christakis is a famous pediatrician in Washington in 2004. This is like so long ago. He published this paper 11 years ago, or actually 21 years ago, showing that early TV exposure linked to attention and cognitive problems. And that's dealing with ADHD. He thinks that most ADHD is probably media induced. And he's been talking about this for over 20 years, but no one's talking about it in the mainstream media. And so that's why I'm here. I'm here to do this, and I'll answer the questions and address these questions that you have at the end of my podcast. And then Dr. Heffler and Ostrecher in 2016 wrote a hypothesis paper on virtual autism, showing that social deprivation occurs with digital devices, which makes sense. I was on a flight recently, and behind me was a young couple with a baby, and they would just play Mary Poppins over and over and over again. And they did that before we got on the plane, but when they got on the plane, the baby could not calm down. She could not calm down unless there was a screen placed in front of her. So the whole time we heard the baby whine, or we heard Mary Poppins play on the screen. So that's social deprivation. She's not interacting with her parents. She's not interacting with other people. She's interacting only with the screen. So new research is actually showing now too much screen time in infancy is linked to speech delays, tantrums, and autistic-like symptoms. And a world-famous person, you can actually look up her book, is Victoria Dunkley. She's an MD. She's a pediatric psychiatrist who wrote Resetting Your Child's Brain. And she basically says that a 30-day no digital media exposure actually reduces a lot of problems like tantrums, speech delays, autistic symptoms, also depression, cutting, suicidal ideations, and other mental health disorders. This is a board-certified psychiatrist, an MD, who is saying this, that screen time, when removed, can actually reverse a lot of these things. So there's also correlations that basically early screen time use causes speech delays. And it is without a doubt. During the pandemic, I'm a gamer. I don't play as much anymore. I don't play at all anymore, but I'm a gamer. I was playing Fortnite, and I was playing Fortnite with a 13-year-old autistic boy. And man, this kid was amazing. In Fortnite, when you play, there's like 100 people, in the game. He would kill half of them. And I would just walk around and heal him like a healer, like a doctor with a bandage gun. But my point on this is that his speech was so terrible. He was severely delayed in his speech. But I took time to communicate with him, and I just asked him, how much are you playing, in a day? And you're supposed to be in school. Why are you in school? And it was during the pandemic, so he would not go to school, or he would just have the school on the side, and then basically, play the game. And he says his parents let him play 15 hours a day because his parents don't want to deal with him. And so in a way, I became his friend. And so every time I got online, he would text me to play. And I learned a lot about, that kid and why he had such speech, impairment. He spent all his brain power on how to kill effectively in Fortnite. I mean, he was a master at that game. I sucked at that game. And he spent all his neuronal power, instead of developing speech and social skills, he spent his power, his neurological energy into becoming probably the top Fortnite player in that region. So a baby's brain grows faster during the ages of 0 to 3 than any other time in its life. So that is when the baby needs faces, not screens, to wire correctly. So you need to be in your baby's face, not YouTube, not Cocomelon, not some person online singing to your baby. Your baby needs you, because screens can't smile back, can't respond to your child like a human being. And that is what builds brains and a regulated human being. And that's what we want. It also builds a human being and is protective against autism and autistic symptoms. So instead of having a severely autistic child, you will have a high functioning autistic child. And this is my theory. And I'm telling you, I'm going to talk about this for decades. And I'm going to have to talk about for decades, because the pain point is already great. When you have a disease that went from 1 to 10,000 to now 1 in 31 and 1 in 12.5 in California, the pain point is getting severe. People want answers, and they're going to look for all alternatives. And I'm telling you, they're starting to look at this. You look at my YouTube channels on autistic, virtual autism. Parents are doing it and they're reporting. And I think that's fascinating, because without doing research, they are offering information, because I can't really do research on the internet ethically. There's no IRB that would let me to do that technically. But all these parents are actually doing an intervention, taking the screens away from their autistic babies and children, and then going to the YouTube channel and typing in response. And you'll see in this one too, you will see the same thing. You will see people who are against it, but then you'll see people are for it. 10 years ago, less were for it than today. But now I think this is the time to get vocal about this, because every single year matters in helping these children and to prevent exacerbating these symptoms. And excessive screen time in toddlers is linked to language delays, emotional dysregulation, poor motor skills, and higher autism risk. This is fascinating. So the poor motor skills, I've seen children whose parents are just amazed that they can actually use the tablet and do these puzzles. But when they take a similar puzzle in real life that's 3D, they can't do it. The baby cannot work the puzzle. That is what we're talking about, poor motor skills. So using the screens to calm a child now, you're going to have to pay for it later, because that leads to much bigger meltdowns later, and the possibility of developing autism and also autistic symptoms as well. So yes, it can be convenient for you now, but you're going to pay for it later. All right, so I'm gonna jump in here and talk about like, some of these questions that are being asked. Okay, so not a lot of questions, but a lot of comments. So the first one is my friend here. I recognize his tag. It says Dr. Doan articulated his background in neuroscience to explain autism and the neurodivergent spectrum. Kevin Roberts, but a therapist, he goes, when you have a national megaphone, you need to be very careful what you say. Yeah, that's true. Thank you very much. One possible, please consider saying you could have a higher functioning autistic child instead of will have. It is a possible means of that happening, not a sure thing. That's true. But in clinical, so basically in clinical medicine, it's going to change the trajectory. It will be, we have enough data now to show that, for example, if you have an autistic child and let's say their level of autism is here, and you take the screens away, even if they're neurodivergent and they have severe genetic risk factors, the trajectory will be here without screens versus here with screens, or even here worse with screens. We have enough data now to know that too much screen time, meaning that, what is too much screen time? 8 hours a day. The average American child, based on the Kaiser Foundation research in 2010, shows that the average American child uses 7 hours, 38 minutes a day. But a child with autism probably uses much more because it's easier to babysit that child who's neurodivergent. So they are using probably screens of 8 to 10, 12, 15 hours a day. That is what I'm talking about. You have to severely reduce that. Without a doubt, in all cases of human interactions, if you expose a human being to 12 hours of screen times a day, you're going to mess that child up, guaranteed. So that's why I'm saying, if you take it away, you will see improvement. Kevin Roberts went on and said, and yes, people not on the autism spectrum can, after a few hours of intense screen time, start to develop some of the classic signatures of autism. Yeah, that's true. So if you are born with autism, and even without screens, they can actually revert back. But keep in mind, it's actually what is the long term. So I'm not talking about just a few weeks of removal. I'm talking about a lifetime removal. So I'm talking about reduction of screen time severely. I'll give you an example. There was an autistic child, and I gave a talk in Hawaii. I get these invitations to talk at various organizations and institutions, churches and schools. And there was a severely autistic child who only watched it was The Wizard of Oz. From the age of 5, that child could recite The Wizard of Oz from memory. It was cute at 5, but that was the only thing that child was able to do really well. So the parents just gave him a tablet, and that's all he did. At age 25, 20 years later, he's sitting in back of the church, just watching The Wizard of Oz over and over and over. At 25, it's not so cute anymore, right? So that's what I'm talking about. So was that a good use of digital media? I can guarantee you that they've taken the screens away or reduced the amount of times that child could watch that screen. There would have been a much bigger, different outcome. How do I know? It's neuroscience. Malcolm Gladwell in his book Outliers says you need 10,000 hours to become an expert of something. If your child who's autistic, who's spending tens and tens and tens of thousands of hours on the screen, they're going to be an expert in that. But if you take that away and severely limit the screen time, what you're going to get is actually other 10,000 hours of development in speech, empathy, human interactions, social interaction. So Lori Form said, can you talk about what happens if screens are removed and replaced too soon after the child gets better? Yeah, that's great. So Lori Fromm is a early interventionist, and she made a really good point. So parents often take away the screens, see improvement, get excited, and then give the screens back. The child will actually regress and actually can get worse. It's almost like an addiction. So the child already wants a screen because it's addictive. And you want to know why it's addictive? Just look up my other videos. I have a video on digital drugs, also a video on video game addiction. And actually, Kevin Roberts and I are going to come online next Saturday to talk about basically ADHD and screen time. So the screens are addictive. And so that's why they want it. But if you take it away, they get better, and you give it back, they will regress. We've seen it over and over and over again. But if you want to be like, just to be safe that some kids won't regress, most will regress. Maybe some won't.